course with you. My role as clinical coordinator for the Director of Audiology program revealed a need in the curriculum to provide a clinical simulation model to prepare students for clinical rotations in their second year. In the first year, students are mainly observing and assisting with basic hearing screening assessments. In the second year, they're placed in community audiologist private practice, hospital, and educational settings where they're expected to perform audiometric assessments. Student lack of confidence is a direct result of not being able to practice the audiologic evaluation from start to finish. This course strengthens connections between coursework and clinical applications, as well as technical proficiency in testing. In speaking with faculty, affiliated preceptors, and students in various stages of our program, I identified a need to further develop the students in their audiometric testing procedures for accuracy, speed, and confidence. The overall goals of the new course are targeted to address these preceptor concerns of interruption to patient flow and significant time instructing students during the clinic day, and student concerns of anxiety over performing test procedures under time restrictions in busy clinics. Instructional content includes a hybrid design that incorporates online learning and weekly hands-on labs. Online content supports development and application of concepts through online class discussion boards, diagnostic case studies, simulation software, and self-reflection activities. The in-person lab transitions from peer simulations to standardized patients. Labs are scaffolded and feedback is immediate. No new content is presented, but learning objectives concentrate on higher levels of Bloom's taxonomy. By the end of the course, students have performed an evaluation from start to finish multiple times, and their evaluation test time is reduced by half. After each lab activity, students evaluate areas where they feel they performed well and areas where they need concentrated practice. Students have multiple experiences of the patient encounter, enabling them to practice learned skills and develop confidence in the audiometric evaluation appointment in a real-world setting. In addition to performing these assessments, the clinical simulation model incorporates troubleshooting for common equipment malfunction, identification of test inconsistencies, performing a thorough case history, practicing patient instruction for each procedure, explaining test results to the patient, and professional report writing. These hands-on opportunities are an important way to help students analyze the test data and recognize inconsistencies in the test battery. Similarly, students need to identify issues in the test procedure related to patient compliance or equipment malfunction. All of these skills are only mastered through experiential learning. This one-credit lab course has a huge impact on communication skill development, active listening and questioning during the case history, immediate decisions to modify a test technique for specific populations, critical appraisal of the test results for accuracy, analysis of the test battery for differential diagnosis, and self-reflection. This teaching innovation is not new, but it impacts students, preceptors, and clinical sites significantly. Students feel more prepared for their clinical rotations, having gained experience in testing unfamiliar people. Indirectly, the course impacts preceptor and host sites by improving clinic flow, reducing the time it takes for students to perform tasks that can be quickly completed by the provider, and reducing time required by the host in regard to student instruction, skill development, and evaluation processes. I was able to discuss this course with community providers, and it had an overwhelming positive result and seen improvement in student performance. I've also been able to increase the available clinical rotations within the community based on this program. The course was developed and implemented in spring session 2 of this year and was well received by students and preceptors alike. Students reported more confidence in entering their clinical placements. Preceptors confirmed students are more confident and better prepared for performing in the clinical setting. A simulation course is easy to develop and the cost is minimal. Our department requires our first-year students to purchase a $35 audiology simulation software subscription. Existing equipment was used and online content was no cost to the student or the university, and this idea is scalable to any healthcare education program, and I'm sure some of you already are familiar with incorporating simulations into your courses. However, adopting a clinical simulation course that incorporates experiential learning, peer tutoring, and self-reflection can help students make connections between coursework and clinical practice before entering the demands of a clinical rotation. Simple, repetitive opportunities to develop the psychomotor domain, which is important in healthcare to demonstrate technical proficiency. Are we providing enough opportunity for rote practice before sending our students to their rotations? Thank you for listening. I hope you found this presentation informative.